So,
and melanoma.
all right. So, Dad, how did you find out that you had melanoma in your toe?
Well, I noticed that I noticed a growth in my toe, sort of a bump growing up out of my toenail bed, and it was kind of pushing the nail off to the side. And obviously, I knew it wasn't anything normal, but I didn't know exactly, what it was until I went to see my podiatrist, who called it, said it was some benign growth, removed it, said, that I wouldn't have a toenail, but everything would be fine. And then about a week later, I went back to see him, and everything was healing fine, and was going to go back for another follow-up in a couple weeks. And then that was on a Friday. Then the following Monday, I think it was August 31st, I got a phone call from him, from the podiatrist, and he said that he had just heard from the pathologist, and that the growth was melanoma. And was kind of, it was a shock. It was a mill of work. I was in Englewood on Grand Avenue working with one of my reps, and about 3:30 in the afternoon, and was, there was the word, and the first thing I thought of was having the physician, having the doctor call Carol, because she worked in the oncology clinic in at Summit Medical Group, and I knew that she could, help me do what I need to do to get through this with the other doctors that I was going to need to see once I got that diagnosis.
Well, I was sitting at my desk at work. I am an oncology clinical nurse specialist, advanced practice nurse in a very busy hematology oncology practice. And I was sitting at my desk, and I got a call, and they said it was Dr. Yu calling about my husband. And I was a little baffled, and I thought, I wonder what this is about. Picked up the phone, and he said, Carol, I just want to tell you, I just told your husband that he has malignant melanoma of his toe, and that he needs to see an oncologist right away. And I said, okay. How big was it? How extensive was it? And he said, I don't have the final report, but I just wanted to tell you what was going on, and you need to have this taken care of right away. So after I sort of picked myself up off the floor, I literally walked next door to the doctor that I work for, Dr. Wax, and I said to him, he was in the middle of seeing patients, a very busy time. He said, I said, I need to talk to you right away. And I sat down and I told him what was going on. And he said, I will see your husband tomorrow morning for a consult. I walked back out, I talked to the nurses. I was pretty shaken up by then. Walked back out and told the nurses that I needed a consult. They got him right in the schedule the next morning. They asked me deep questions, and at that point I didn't have a pathology report. I just knew he needed to see a doctor right away, an oncologist, and I felt that at that point my whole world sort of flipped over. What I do every day is I sit on the other side of the desk talking to patients who just have new diagnoses, bad diagnoses of cancer, and here I was on the other side of the desk, which was really a new experience for me. It was very emotionally draining, and I was very upset, but I knew I had to sort of take action, because with this kind of disease it can be curable if you move very quickly. So we began the whole process of seeing doctors at that point. The next morning we saw Dr. Wax for a full consult. He said that we needed to see...
We talk about what happened then.
Okay. We need it. Don't we stop there?
Yeah, just
okay.
You can edit
so here
all the
you
stuff.
can. Okay.
Doesn't matter.
Next.
So then, once my doctor called Carol, she had talked to Dr. Wax, and I was able to, fortunately because of where Carol worked, to see Dr. Wax right away. Like I said, she said the next morning. And then part of the treatment is isolating the cancer, and because of where it was located, he informed me that they were going to need what they call, I guess, a margin, a clean margin on my toe. Exactly what that meant, I wasn't quite sure, but I figured something was going to happen where they were going to have to remove some of that, my fourth toe on my left foot, which is where the tumor was located. So then I had an appointment. They made an appointment for me that Thursday with a plastic surgeon. And basically what he told me was they were going to remove the entire toe. And so it was, not great news, but, something that I knew was necessary to have done. And then the next day I was also able to have a PET scan done, which was where they, you swallow, well, you can explain more about the test, but the good news was this looks for any spread of the cancer throughout your body, and fortunately there was none seen. So that was, like I said, that was good. And then on Monday was Labor Day, so surgery and everything was scheduled for Tuesday, the day after Labor Day. And that morning they did a lymphoscintigraphy, which is where they mapped out my lymph nodes in my leg, because they remove one of those to see again if there's any spread of the cancer in your body. So surgery was that afternoon about 4:30. The surgeon who was removing the lymph node came in to see me. The plastic surgeon came in, marked my toe as far as what he was going to do as far as removing it. The good news was he didn't have to remove the entire toe, just 2/3 of it. I have a little piece, the first knuckle is still there. And surgery was complete, the lymph node was clean. Surgery went well, and recovery was maybe 4 or 5 weeks until I was really fully able to walk comfortably on the
Another
foot.
turning point, a fork stuck in the road. Time grabs you by the wrist, directs you where to go. So make the best of this test and don't ask why. It's not a question but a lesson learned in time. It's something unpredictable, but in the end